on socioeconomic status and how to measure that. Just as a give a brief introduction, Dr. Scherban is a associate professor in the Department of Epidemiology and Biostatistics at Drexel School of Public Health, where she also leads the training core of the Drexel Health Urban Health Collaborative. She has a PhD in epidemiology from the University of Michigan, as well as an MPH in epidemiology from UC Berkeley. Her research centers on health disparities with a focus on pediatric health disparities, life course determinants, and immigrant health. Her work has examined intergenerational socioeconomic influences on mental and physical health, neighborhood social context, and cardiovascular risk among immigrants. She currently serves as lead for the Philadelphia site of Children's Health Watch and a co-lead of the West Philly Promise Neighborhood Data and Research Core. She also leads an NIH-funded project to investigate how food insecurity, neighborhood conditions, and food assistance programs come together to affect growth in young children. With that, welcome back, and thank you for taking the time to speak with us today.
Great, thank you. Thanks for the chance to talk with you. I'm glad to be here. I'm going to attempt to share my screen. Can you see my screen and hear me okay? Okay, great. So thanks. Yep, I'm going to talk about measuring socioeconomic status today. And much of the, I guess, the content that I'm going to present, I think will likely already be familiar to many of you. But I think it's, you know, socioeconomic status is such a fundamental determinant of health. I think it's helpful sometimes to just talk through it in a systematic way. So the definition I like to use for socioeconomic status is the one that Oakes and Rossi use in their, they have a document about measuring SES from 2016. That SES indicates one's access to collectively desired resources, be they material goods, money, power, friendship networks, healthcare, leisure time, or educational opportunities. Just a semantics note, you'll sometimes see or use the term socioeconomic position. Some of that is just kind of cultural. I think European, for example, studies are more likely to use socioeconomic position, whereas often in the US, we're more likely to say socioeconomic status. In this context, I am referring to socioeconomic status because I'm referring to, I guess, the natural status, whereas position tends to refer more to relational position relative to other people. So why would you measure SES at all? There are several reasons. I group them into four main buckets. One is to describe disparities or health inequities. Two is to identify causal mechanisms through which socioeconomic status affects health. Third, and I am guessing that this is a very common use that you have use socioeconomic status measures for before, is to adjust when investigating other exposures, because socioeconomic status, as I said, is such a fundamental determinant of health. Very often it's going to be a key confounder in other studies because it's going to be causally related to both the exposure and the outcome. And then lastly is the use of socioeconomic status to predict risk and to help with patient risk stratification. So there are, in general, there are three main measures or domains of socioeconomic status, and these are the three that I will talk about, focus on today. Education, employment, which I'm also taking to include measures of occupation, and then measures of money, financial resources. And the two measures that I'll discuss today are income and wealth. They're, I would say, the two most commonly used measures of money as a form of socioeconomic status or an indicator of socioeconomic status. So starting with education, education has been called the, Nancy Adler, I think, referred to it as the most basic, the most basic or fundamental indicator of socioeconomic status because of the implications of education for later on income, employment, these other markers of SES. And that's demonstrated in this little graph that shows unemployment and earnings by educational attainment in the US as of 2019. So this is not surprising. You can see this very, very strong dose response where those with higher levels of education here on the left are less likely to be unemployed and have far higher earnings. So I just want to talk a little bit, and I'm going to do this for each of the measures that we talk about today, talk about the pros and cons of using education as a marker or an indicator for socioeconomic status in a research study, depending on what your research question is. So as I mentioned, education is the basis for, or largely the basis for, future occupation and income. In my mind, that makes it that's a big plus in using education as a measure of socioeconomic status. There's a very low refusal rate. People generally do not balk at sharing education information. It's easy to assess. It's short and easy to measure accurately in a survey, for example, or a questionnaire. It's a measure of socioeconomic status that applies to everyone, even for people who are not participating in the formal labor force. And then I put kind of a plus and minus. Education is generally stable over time among adults. That's not to say that there are not adults who continue lifelong learning, continue education. Many of us in this real or virtual room have continued to get education well into adulthood, but compared to the other measures, it tends to be fairly stable. Now that can be a plus or a minus depending on your research question, right? If you're looking, for example, to find a pretty stable measure that you can just adjust for, I think that makes education a very, a very strong measure. If, for example, you're looking at changes over time or how fluctuations in socioeconomic status affect health, then clearly education is not going to be your go-to measure. Some cons in using education. There have been major secular changes in education over time. So particularly at historical or long-term studies, your data are going to reflect the fact that overall education levels have increased substantially over the last few decades. Another thing is that quality and prestige matter. We very rarely account for school quality and school prestige in our measures of education, but they can make an enormous difference in terms of later access to resources. And then the income returns to education vary very systematically. Another challenge is how to handle continuing informal or quote unquote non-traditional education. Just to give you an idea of what I'm talking about the income and economic returns to education varying. What this graph shows is as of 2016, it shows the median annual earnings of full-time year-round workers in young adulthood, 25 to 34 years old, stratified by both educational attainment and race and ethnicity. And just to give you an example, you'll notice that as of 2016, right, these young adults, those who were white with less than a high school degree, were roughly earning the same amount of money as those who were Black but with an associate's degree. So very substantial disparities in the income returns to education by race. Throughout this presentation, I'm going to just, by way of example, I'm going to be showing the measures, the questions for these various measures of SES that are used in NHANES. So this is the NHANES education question. What is the highest grade or level of school or the highest degree that the participant has received. So you can really see, like I said a few slides ago, this is very easily assessed, right? It's one question, it's pretty clear. One thing to notice is that at the lower end of the education spectrum, the question is asking about each grade completed, whereas once you get above high school, they're asking about these kind of about credentialing as opposed to years of education. And this really gets at, you know, one of the decisions to be made, right? I see when you're doing any given study and you're going to be measuring and using a measure of socioeconomic status or measures, there's this cascade of decisions, right? What measure or measures to use, and then how to use them. So let's say you've decided to use a measure of education, you can use that either in a continuous way or a categorical way. For example, less than high school, college degree. What's nice, if you are going to use categories, it is good to make the cut points at credentials because of what's called the sheepskin effect. And that's because like diplomas used to be written on actual sheepskin. So the sheepskin effect in SES and health is this idea that besides any benefits you get year to year, just in terms of your own human capital and your knowledge and your skills through education, that you're also going to be getting some additional benefits purely from having a credential. So for example, just a credential will then get you a higher level of job that will then get you more salary. So you want to be able to capture that as well in your measure. Sometimes for reasons of parsimony, for example, you don't want to include multiple indicators, and then you'll sometimes see a continuous measure. Often when people are going to use a continuous years of formal schooling completed measure, what they will do is when they get to these, for example, if you were to do that in NHANES data, is assign some kind of typical or median years to these credentials. For example, 2 years, you know, making an associate's degree equivalent to 14 years of education, a bachelor's year equivalent to 16 years of education. Okay.
Can I ask a question?
Sure.
If you're going over this later, feel free to punt it. And this is, I was thinking about it with education, but it's probably across all the measures.
Yeah.
What about generational education? Like, you know, your parents, your grandparents, and what that looks like. How do we think about capturing that across some of these measures?
Yeah, so actually I'm going to talk a little bit about that later when I talk about how to measure children's SES.
Okay.
Generally, and I've done a lot of work looking at this, particularly with education. I mean, generally what you would do is just directly assess via survey the parents or even the grandparents' education. What gets hard to think about is some of those strong secular trends there, because the meaning of a certain level of education as you go up generations, particularly for and also you know, for income, the meaning of a dollar is going to change so dramatically across generations. So just being clear that any comparisons you're making, although they you might be looking at effects across generations, you want to be making comparisons within the same generation, if that makes sense.
Thanks.
Okay, so I'm going to move on now to our second bucket, which was the employment and occupation bucket of indicators. And just like I did for education, I'm going to talk about some pros and cons of using employment as a measure of socioeconomic status. So a plus is that employment is kind of the link between education and income. So it kind of brings together the pieces of the puzzle of socioeconomic status. Similar to education, there's a low refusal rate. People are generally comfortable sharing information about their employment status. It's fairly easy to assess and to measure. And it can capture multiple different dimensions that are relevant to health. For example, working conditions, job control, demands, strain. And again, plus or minus depending on your research question, employment tends to be a more stable marker of socioeconomic status than income, meaning it's less variable over time, but less stable than education. Some downsides of using employment as a measure. It can be hard to capture and to categorize people who are not in the formal labor force. Historically, also, this has been an issue with, for example, stay-at-home parents. It can be hard to classify. There's so many different types of work and types and hours of employment that people do. Similar to education, the income returns to employment can vary dramatically. There are major gender and race disparities, but also major geographic differences in pay. Here is the NHANES question about employment. One of the difficult things in measuring employment, because it is more variable than, for example, education, is what time period to ask about. In NHANES, it's assessed just during the last week. So it asks people what their employment status with several different categories here over the last week, and then the number of hours that they worked. And you'll notice that there are two different categories for not working versus not working but looking for work. You may have heard in the news with COVID, there's been a lot of talk about that distinction. For example, as employment rates have increased as we get farther, I guess, into or out of, depending how you think about it, the pandemic, there's some question about to what extent is that just due to people dropping out of the workforce and no longer looking for work. Where it gets more complicated is measuring occupation. So not just whether and how much a person is working, but at what type of job they're working. This is much more complicated to assess. So in NHANES, what they will ask is, there's a whole series of questions. They ask, for whom did you work at your main job or business? All right, and already we have some complication because many people are going to have more than one job. But whatever, this lets the participant decide what they consider their main job. And then there's this question, open-ended question about what kind of business or industry this is, and then what the specific duties are. And you'll notice, I think I always take the interviewer notes in NHANES as an indication of how complicated things are getting. You start seeing a lot of notes to the interviewer, like a prompt to enter what would be on a business card, or probing for more detail for some common responses. And then there's another follow-up question. Well, okay, what are the most important activities on the job? Or walk me through a typical day. What do you actually do on the job? So these are all very important nuances, but as you can see, very difficult and time-consuming to assess. And this is not even getting to, you can imagine a survey like NHANES, thousands and thousands of people, this all has to then be coded on the back end. This is a lot of open-ended questions to then be coding and categorizing. And you see there's yet another attempt here about occupation, just getting an idea of the broad domain, whether this is someone working for a public or a private company, whether this is, we talked about non-formal labor participation. You'll notice that there's a question response here about working without pay. So once you have collected this wealth of very complicated information, your choice in how to then operationalize that in terms of the variable or variables in your actual analysis, you can use, I think the most commonly used is just employment status, employed, not employed, and sometimes there are more categories in that, employed part-time, looking for work. And then if you want to get, if this is of interest to your research question, if you want to get more detailed, then you can talk about qualitative domains or types of occupations or occupational grade to make some sort of a classification. I would suggest, I think for most research questions, if this is if employment and occupation are confounders, I think it is often, frankly, not worth the amount of time and resources it's going to take to really delve into occupation type and grade. But there are other research questions for which that is a key part of the exposure or of key interest, in which case you absolutely do want to drill down. Okay, I'll pause for a second before, and I'm going to move into the third bucket, which is income. Any thoughts about occupation and employment? All right, then income. So clearly I'm going to do the whole pros and cons thing. A big pro of using income as a measure of SES is that is a direct measure of purchasing power. If we're trying to measure access to resources, in some ways, this is the most direct way to do that. As I'm sure many of you are aware, though, people feel uncomfortable sharing income information. There can be very high refusal rates, 25, 30% refusal on income questions is not at all uncommon.
Is there a difference? Is it non-differential, the refusal rate?
Oh, that's a good question. I don't know. I actually don't know. That's a really good question. I think in general, a refusal is higher at both ends of the spectrum, but I don't know if it's higher at one. I don't know if, for example, refusal is higher among those with very high incomes than very low incomes or vice versa. Does that make sense?
Yeah.
I'm sure that information is out there somewhere. The purchasing power differs by area. There's also this potential downside or something to consider, which is accounting for household composition. If you have income coming into a household or coming into an individual, how many people is that income having to support? It's also very hard to measure accurately. Folks have income coming from multiple different sources. Some of them are employment related, some of them are not. And also having to take into account taxes can be really complicated. And sometimes one of the difficult things is that sometimes people are not always aware of the sources of income or what would be counted as income that they're getting. So one, for example, is that some of the work I've been doing has been looking at effects of the earned income tax credit and the child tax credit, particularly the expansion in the child tax credit during the pandemic. And often, people will know if they're getting or not getting a check each month, but may not always know the specific attribution of that check or all the calculations that have gone into the amount of that check. And then plus or minus, depending on your research question, income is highly variable over time. So in terms of, for example, looking at causal effects of income in the short term and fluctuations in income, it's a good measure in terms of capturing those changes. But it also means that if you, for example, have cross-sectional data with one measure, there's a lot of information you're losing there. So let's talk about let's just take a look at how NHANES measures income. You'll notice through these series of questions, two issues, right? One is trying to help people understand what to count when they're reporting income, and two is techniques to try to encourage folks to answer the question because it's such a sensitive question. So see the question asked, now I'm going to ask you about total income, and notice that in the question stem, there's a list of the sources of income to try and encourage people to be comprehensive in what sources of income they are reporting. So you'll see it says wages, salaries, Social Security, retirement benefits, help from relatives, and so forth. And, there is some it is somewhat open to interpretation what that so forth includes. And you'll notice this probe to the interviewer, and this is trying to encourage participation. Income is important in using the health information we collect. For example, it gives an example of why using this income information is important. And these are kinds of probes that I use a lot in my research as well. Another strategy that can be helpful in asking about income or encouraging participation is to use what's called unfolding brackets. And what that means is having an initial question here that says, okay, you may not be able to or be willing to give us an exact number, but can you just tell us, is it less or more than $20,000? And then what you can do is sometimes, that gives you at least some information. And then where the brackets unfold is then you can see if the person can kind of, well, within that under, now we know that it's under $20,000. Can you let me know, do you think it's 0 to 10,000 or 10,000 to 20,000, and just try to get more specific from there. So in NHANES, they actually have these cards with different categories within the large brackets of income.
Excuse me, can I ask a question?
Yeah.
Yeah, sorry. For these last slides that you mentioned, is there any rationale behind the, exact numbers that are determined, or is it just a classification?
That's a good question. So that depends on the study. I'm not sure of the rationale between the $20,000 cutoff in this particular question, but often when you are doing these brackets, what many studies do and what is helpful is to use, kind of like for education, to use meaningful cutoffs. So often that will be a cutoff that is somewhere around, for example, that would determine eligibility for a means tested program like Medicaid or SNAP. Or to use a cutoff that I think that might be where the 20,000 comes from, that approximates the federal poverty level for, say, a typical, whatever you consider typical, a family of 4. So it's that's kind of where you would usually want to go in your initial choice of cutoffs. Does that make sense?
Thank you.
Mm-hmm. So once you have collected that information, then you move into how to operationalize that as variables or a variable in your analysis. You can use income continuously or in categories. Very often for continuous, when people are measuring or using, not measuring, but using an income measure continuously, they will log transform it because of the very long tail of higher incomes that you tend to see at the okay, I see that. I just saw a question, something in the chat, but this question. Lisa, did you have your hand up?
I did. Are you able to hear me? I'm struggling with my internet a little bit. Good morning, everyone. So, Felice, I'm hoping you could either now or later kind of talk about the adjustment of income by household size and using it for means testing, because in our studies, like we almost never will use straight income, but we'll only use it adjusted by household size. And at those threshold cutoffs that you just mentioned, either at 1 time or 3 times the poverty threshold, which are often the means test for public programs. So I was wondering if you could just comment on that a little bit more.
Yep, exactly. And I think I have that. Yep, here it is. It's the next bullet. I similarly almost always do that. And I think what Lisa is referring to is, or the one common way to do this is to express not the actual income, but to convert that into an income to poverty ratio. And what that will do is give a more standardized measure of resources where because the poverty level takes into account, it's a dollar amount, but it's specific to the year and also accounts for household composition, the number of people in the household as well as their ages. So accounting for children and older adults and non-older adults in the household. And the actual, the means test that Lisa was referring to, the thresholds for eligibility for programs like Medicaid, SNAP, use this income to poverty ratio and the federal poverty level, which takes into account inflation and household composition. So similar to what Lisa was saying, I will almost always use not just regular dollars, but dollars standardized to the federal poverty level in studies. And actually, I've noticed, I'm working on an NHANES study right now, and I noticed that that is also their suggestion, and they are not even providing the kind of absolute income measure in the same way that they used to, and are just providing that calculated income to poverty level. One thing to keep in mind when looking at income is if you're looking over time, you do have to adjust for inflation. Again, that's another positive of using a ratio of income to the poverty level, because then that is stable over time, irrespective of inflation. But if you're using an absolute measure of income, then you have to adjust for inflation. And relatedly, sometimes because of the importance of these specific income levels for eligibility for public benefits programs, will sometimes, instead of using a direct measure of income, even converted to a ratio, just use participation in these programs as a proxy. Often in, for example, in health record data, you'll be using like insurance payer as a proxy. Other thoughts about income? Okay, so the last little bucket here, I'm realizing we're a little short on time, is wealth. I'm actually a big fan of wealth as a measure of SES. It really more comprehensively accounts for purchasing power, as well as economic stability, having a safety net and standard of living. Also, the inequalities in wealth are far, far larger than inequalities in income. So using wealth as a measure of socioeconomic status, and specifically as a measure of economic resources, captures much larger inequities than income. However, similar to income, there's a very high refusal rate. People do not like to share information about their wealth, and it's very hard to assess and calculate, even compared to income. It can be hard as an individual to really know what all the sources of wealth are, or what wealth you have access to. Wealth does vary over time, but does tend to be a bit more stable than income, which can be a plus or minus depending on your research question. To give you an idea of disparities in wealth, these graphs show wealth disparities over time on the left between Blacks and whites in the US, and in the right between Hispanics and whites in the US. And you'll see that as of 2016, on average, right, whites in the US had 10 times the wealth that as Blacks in the US on average, and whites in the US had 8 times the wealth as Hispanics in the US. So very large inequalities.
Could you define wealth, please?
Yep, wealth is well, here, let me go down to the next. Oh, so I should have put this slide earlier, but wealth most often is defined as net worth. So all the assets that a person or a household has at their disposal, minus the debts. So what that means then in terms of measuring wealth is that you often need to ask about each of these assets, because people will, like I, for example, don't have a number in my head right now that adds up all my assets and subtracts out all my debts. So you generally will have to ask people about, for example, I'll get to, I think I have an example question. Oh, I don't. So for example, a typical series of questions will ask you, do you own your home? Do you still owe a mortgage and how much? Do you own a car? How many vehicles? What years? The most common those are the most common assets in the US. And then do you own a business? What is the worth of the business? And then move on to questions about debts. Do you, what do you owe on your house? What do you owe on your vehicles? What kinds of loans do you have? Do you owe money to relatives? Do you carry credit card debt? Do you carry student debt? And then do all the addition and subtraction there. So going back, sorry. Oh, and now I'm all out of order. But yeah, so this is generally, it's not asked as often, wealth questions, because they are harder to ask. And it's generally a series of questions about specific assets and debts. The other way I would say, besides kind of an assets minus debts approach, would be to simply ask about assets and then to do some kind of account of assets. You see that approach to measuring wealth, I would say, more often in lower income and developing countries, where, for example, you do need to identify what the specific assets are that are markers of resources in a specific context, and then ask people. So some typical questions, depending on the context that you would see about wealth, might be about owning livestock, indoor plumbing, vehicles. Just an interesting, I think, point about the context specificity of these kinds of asset questions is I was talking recently with someone who conducts research among very high income populations in the Middle East. And she said that in talking with stakeholders there, what they identified as the primary measure of wealth they use is to ask people about the number of cars they have, and then use that count of cars as the measure of wealth. Because in that particular context, that is a useful way to differentiate wealth. Does that answer the question?
Yeah, I just have one quick question about this.
Uh-huh.
Dawned on me just now is, and you may, if you're going to talk about this, just cut me off. But it's the variability in household wealth. Let's say for a middle income family who has a senior in high school who's been saving for college, they have significant assets. But 4 years later, those assets, even though they're not debts yet, they're kind of in the debt category because they're already, all going to get spent. So their wealth changes dramatically in a brief period of time.
That is a really good point. And it's not in most, I'd say it's rare enough to ask about assets and debts and wealth in general. It is even rarer to account for kind of I think you're talking about kind of like accumulated wealth, but that is going, with a planned use in the short term, where it is not going to serve as like a safety net or a long-term resource, because it's going to go out the door for some earmarked
Right. And the idea being for a middle income family, it could be a huge thing.
Exactly. I absolutely agree. And I would say that I'm trying to think, I don't think I have ever seen a study that specifically accounts for that. So that's in that sense, I think you're catching people where they are, and that's going to definitely be a source of misclassification. And all you can do is hope that it's getting averaged out at the population level. That's a really good point.
So it's kind of a related point, which is that I think a student may have a higher net worth than I do because I have a mortgage, right? They're paying, they're renting their apartment, but you know, if you count my mortgage against my, doesn't that penalize people who are house owners?
Yeah, so generally that'll be like an equity calculation, like value of the house minus what's owed on the mortgage. Is that, yeah.
It's also an interesting thing, like we all know people who spend everything they get. And other people save, you know, like it's an interesting phenomenon. Some of that meaning because you know, you're at certain income levels, you're spending to simply stay alive. I get that. But at other income levels, whether it be the college student that Cal just talked about, or, you know, either young, middle, or older people, you know, I think that there's different styles of how one, you know.
Yeah, I absolutely agree. And I think, you know, I think that's another reason that within for all of these measures, like there are almost endless rabbit holes you can go down for each of these domains. And I think and I have gone down some of them, not all of them. I think it really, I think it, just like for any measure, then it really comes back to the research question and whether really how worth it is in terms of resources and time and survey time to go down those rabbit holes. I will say, for just a quick plug, you know, there are a number of data sets and surveys that focus on this. The panel study of income dynamics, which is housed at ISR at Michigan, is about, you know, that has a variety of topics, but it is a survey of income dynamics. So it goes into these really in-depth rabbit holes. So if you have, for anyone here who might have a specific interest in these sorts of questions, I would encourage you to look at that data source. So just, I know we're we're a little short on time, but I just wanted to touch on some kind of ancillary or like other considerations in measuring SES. I would say, you know, as you can see, there are a variety of measures. Really, the take home is to just think really carefully about your research question and how important it is to delve into which of the measures. But once you have these measures, right, you do have the option of using one at a time, right? Just saying, I'm going to use one measure as a proxy. I know it's imperfect. I'm adjusting in some way to account for confounding. I know there's going to be residual confounding, but this is the best I can do. You also have the option of using multiple at once, right? In a very concrete sense, you could have, for example, a regression model that adjusts for some measure of education and also some measure of income. Now, you can get into kind of a causal mess because, for example, education is a determinant of income. But if your goal is just to simply adjust away, for example, socioeconomic status to the best of your ability in looking at an association between some other exposure and outcome, then this is another situation where it may or may not be worth delving into the actual causal structure between the measures of SES, as much as just trying to kind of like mop up that confounding as best you can by adjusting for multiple measures. You can also combine multiple measures into a new measure. For example, doing some kind of, there are many approaches to this, doing some kind of a factor analysis or just some way of combining these measures. The idea there is that there is some latent construct that is socioeconomic status, and you can try to combine these different indicators, education, employment, income, to try to best capture that latent construct. So I see a question in the chat about educational attainment and other indices. I think just as this question says, it depends on the research question. Very often, I think particularly among adults and especially among older adults, where further continuing education becomes less rare. I do think that if the goal is adjustment, in many circumstances, I would consider educational attainment good enough. In some situations, no, and particularly in some situations where the interest is very much at the ends of the distribution, right? Where you may have a lot of differentiation that you're not capturing between people who all have low education or all have high education. That said, for example, in many kind of like national sample population, semi-representative scenarios where the goal is adjustment, I do think educational attainment is often sufficient.
Hey, Felice, I know that we don't have a lot of time, but I think I have an important question I think is relevant to a lot of the people in this room, which is the use of area levels, level measures.
Yeah, why don't I just, because we are so short on time, let me just, let me skip to that then and just spend a couple minutes talking about that. So this is just an example. Showing, this is a study we did looking at multiple different measures. And all I wanted to point out here is that in terms of that kind of sufficiency thing, these measures generally will show the same pattern, but where you tend to see more differentiation, similar to what we're saying about education, is at the ends of the distributions. So that's just something to keep in mind when you're making decision about what measures to make. So inequality as an exposure, but I'm not going to go through that because of time, but we're happy to discuss at a later time. Now, area level SES. So I think there are two, in general, there are kind of two scenarios where people will use area level SES. One is if you are actually interested in area level or neighborhood level, for example, effects on health. That's one scenario. The other is when you do not have some individual level SES measure at your disposal, and you're using area level SES as a proxy for individual level SES. I think both of those are legitimate uses of area level SES. If you are doing the second one, by which I mean using area level SES as a proxy for individual level SES, I just urge you to be this is, for example, something we do often in like electronic health record data, where there's not, there may be insurance payer as the only individual level measure of SES, and people will use something like median neighborhood income based on the patient address or poverty. I just urge you to be very clear about what you're doing, and remember that their studies have shown pretty high levels of lack of discordance between individual and area level SES. So you are generating, you do have a bunch of measurement error there. Not to say that you shouldn't do it. I think it's better than nothing, but just be very clear about the limitations. And also, this is just my because I do neighborhood level research, like I just sort of philosophically do believe that neighborhoods do, for example, or areas do affect health. So when you are adjusting, measurement error aside, if you are adjusting for a neighborhood level measure, just remember that you are potentially also capturing some causal effect of that area, in addition to what you're capturing in terms of the individual's SES because of the correlation between individual and neighborhood SES. So just being very clear on what you're doing. Now, the actual measures you can use, I'd say the most common in this country are census-based measures like median income or the percent of residents in a census tract, for example, or in an area where a person lives experiencing poverty. I think these are the two most common measures. The choice between them really depends on where your interest is in the SES distribution. If you want to be able to differentiate more at the higher end, then you would use median income. If you want to be able to differentiate more at the lower end, you would use percent poverty. And some of this depends on your exposure of interest. You can also use indices like factor-based measures. There are many of these in the literature that combine multiple census measures. Two other measures that you may have seen recently are the Social Vulnerability Index, which is a combination of census measures. It was developed by the CDC and has been used a lot in, for example, targeting COVID resources, or the Child Opportunity Index, which was includes many different measures, was developed at Brandeis and is focused on children, so it can be helpful for pediatric research. We're totally out of time, but remember the role of race. I wish we could discuss that more, but it's very important, and it's important to think about whether you're going to include that as an actual SES measure or not. I would argue it is not an SES measure. It is a separately very important measure. And I'm sorry, there's a lot we didn't get to, but I do want to be respectful of people's time, and I will stop sharing here. This was just some comparisons we had done of different measures in electronic health records. And I am happy to have follow-up discussions with people. And I really thank you for all your thoughts and your questions.
Thank you so much, Felice. This was a really terrific talk. We'll be sure to invite you back to talk about some of your empirical work on pediatric SES measurement, maybe in a future methods seminar if you're open to that. I know it's 10 o'clock. I want to be respectful of people's time. So thank you for your talk. This was wonderful. We really appreciate it.
Everyone, please take the survey. There's a link there and a link in the chat.
Thank you.